So that year was very valuable to me. It really made me feel like an expert in brain injury medicine.
The one goal was to make this an advanced program that was well different from the experience they had as a PM&R resident.
I had certain skills that I learned during that year that I wouldn't have learned otherwise in residency, which have now greatly changed the practice that I have.
Fellows often come in with a great experience from their PM&R residency, and one of my goals is to go way above that. So we have a very good program which constitutes multiple rotations. The core are 4 months of an inpatient rotation up on our 8th floor. We have a special unit devoted to people with brain injuries. We also have outpatient rotations where they have various clinics, but they're also the team leader of an outpatient brain injury program. We have a level 1 trauma center. We have a stroke center. We have a fantastic rehabilitation hospital, including the brain injury rehabilitation unit, the spinal cord rehabilitation unit.
I hadn't seen another program that offered these same opportunities. There's excellent training that I knew I was going to get here, but I also had the opportunity to go to some of the other institutions in town.
And we also partner with the Cleveland Clinic Foundation and the VA of Cleveland.
When we welcome the TBI fellows at the Cleveland Clinic, they have an opportunity to see a very busy adult spasticity clinic. They also have the ability to rotate through what we call the Center for Brain Health, which is a very advanced program for people with cognitive impairment.
The VA portion of the TBI Fellowship, to me, is an important opportunity to get exposure to outpatient traumatic brain injury care, as well as to learn about the differences in traumatic brain injury amongst veterans.
So there's a huge diversity in cases that I was able to see, everything from concussion to severe traumatic brain injury and everything in between.
That spectrum, I think, is very important for fellows to have experience with.
They have 1 year to learn a great deal, and we're going to go above and beyond to some of the highest levels so that the fellow could gain independence in leadership in brain injury going forward for their career.
It's not just about bringing the fellow in and having them do the work. It's really about having the fellow learn what they need to learn and really become the best that they can be to lead the next generation. I was looking to become an independent practitioner of brain injury medicine, but I came out of it with so much more knowledge and expertise than I could have even imagined.